Hi, how are you?
I'm fine.
My name is Susan. I'm an RN. I'm going to be doing a physical assessment on you. Okay, so before I do the physical assessment, I just wanted to ask you if you're going to give me consent because the professors at Mercy College will be looking at it and it'll be videotaped. So, and it'll be some of your body parts will be exposed. So I just
It's
want to make
fine.
sure it's okay with you.
It's fine.
Oh, okay. So I just need to know your name. Let me see your ID. What's your name
My name is Lady I.
and your date of birth?
August 17.
Okay. So great. So I'm just going to do some hand hygiene. I'll be right back. So, how's the room for you?
It's fine.
Yeah, it's not too cold.
Mm.
Okay. So during the assessment, when I'm touching, if you feel anything uncomfortable or if you have any pain or anything, just let me know. Okay. Did you want to use the bathroom?
I used it before coming.
Okay, and I saw that the CNA already did vital signs on you. Everything seems normal. You're doing great. So I'll just walk through whatever assessment I'm doing. I'll just let you know. Okay. So first I'll just check your abdomen. So I'm going to just expose. So I'll let you lay down. Okay. So I'm just checking your abdomen for symmetry. I'm checking to see if you have any mass, any scars, any discoloration. Your umbilical seems good. There's no discharge. You don't have any what do you call any inguinal or any hernias that I can see. So I'm just going to first I'm going to auscultate. Okay, and I'm going to be auscultating on all four quadrants, all right? And I'm so sorry, but my stethoscope might be a little cold, so just rub it. Okay, so I am going to listen to your aortic artery. Then I'm going to listen to your left left renal artery, right renal artery, right iliac artery, left iliac artery, and I'm going to be listening to your femoral artery, and I listen to your left femoral artery. Okay, everything seems to be good. And now I'll just listen to your bowel sounds, all right? So I'll start with the right lower quadrant, the left upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, so you have good bowel sounds. That's great. So now I'm just going to do a light palpation. I'm just going to see for any mass, any kind of tenderness that you have. Okay. So I'm just going to palpate gently. Do you feel any pain?
No.
Right here?
Mm-hmm.
How about here? Like rebound tenderness? No?
Mm-hmm.
Okay. So I'm just going to do deep palpation. Just going to check for some mass. Okay, and I'm also going to feel for your liver and your spleen to see if they have any abnormality in size, okay? So, I'm going to just do it. Let me know if you have any discomfort. Okay, it's okay? You feel
Yes.
okay? So no mass, I don't feel anything. So I'll just ask you to take a deep breath, okay? This is for the liver, I'm just seeing for enlargement. Okay, and for the spleen, that's great. So I'm going to do percussion. So I'll be gently tapping your abdomen. If you feel anything, pain or anything, let me know, okay? I feel tympanic. Tympanic. Dullness. Dullness. Tympanic. Tympanic. Okay, so your skin like is okay, your liver is not enlarged, your spleen is okay. So now I'm just going to cover you and I'm going to let you sit up because I'm going to check the CVA, which is on the near the 12th rib, and I'm going to see if you have any infection, okay, or any kind of discomfort over there. So I'm just going to percuss it. So if you feel pain, let me know, okay? On the left side. Okay. Any pain?
No.
No? You feel okay?
Yes.
Great. So now next we're just going to come sit down. Sit. Okay, spin. Alright. So what I want to do is just a quick neuro check, and I'm just going to check your cranial nerves, and there are 12 of them. So do you know what day of the week it is, or what day is today?
Today is Monday, and it's what's today's date? July 8th. Okay, 2019.
Do you know what place this is?
I'm in a hospital.
Okay, so that's great. And you know who our president is?
Yeah.
Who's our president?
You really want me to say his name? Trump.
Yes.
Okay.
Okay, so we'll start with the olfactory. That's the number 1 cranial. So I'm going to give you something to smell. I'm going to close your nostril, okay, and close your eyes, and you just let me know while I occlude. Just keep close mine. Yeah. Okay. So, okay. What did you smell?
Vanilla.
Okay. Okay, so you do the same there. And you tell me, what do you smell?
Cinnamon.
Very good, good, great. So that first one is intact. So we're going to do the optic nerve. Okay, so the optic nerve, I'm just going to let you keep your glasses on, and I'm going to see how your peripheral vision is. Okay, so you're just going to tell me how many fingers I'm holding. So you close your, and I'll close my left. Okay, now look at my, how many fingers?
2, 3,
Okay, we'll do the same on the other.
2, 2.
Okay, great, wonderful. So now the next is a Snell's chart, and you're going to see as how lower down you can read. Okay, so you wear glasses, you're comfortable, you can see. Okay, so just tell me, what is this?
E,
Uh-huh.
I,
Mhm.
Z, D.
Okay, any lower can you read?
No.
Okay, so that's great. So next I'm just going to check the fundi, the ocular fundi of your eye. So just have you take your glasses. Okay, and I'm just going to check. I'm sorry, the light. Okay. Great, wonderful. Okay, so put your glasses back on. So that was the 2. So next we're going to do 3, 4, and 6. Okay, so 3 is the 3, 4, and 6. So we're going to, you want to stand up? Can you stand up? I'm sure you can just hold it. Great. So you're going to see, we're going to do the cardinal sign. Okay, just follow my finger. Okay, so, okay. Okay, that's great. Okay, so have a seat. So, 1 second, okay? Okay, so we did the visual field, and the next I'm going to do is, let's see, the trochanter. Right, so we did the 6 cardinal, and you saw. So can you see the distance? Okay, and I'm going to check your pupillary reaction. All right. Okay. And okay, so they dilate and they constrict. So it's good. It's normal. And so the other one is the for any nystagmus, which I didn't see your eye shaking. I didn't see ptosis. Your eyelids are fine. Okay, so next we're going to go to the trigemini, which is the 5. Okay, so I'm just going to touch your forehead. I'll let you close your eyes. So, okay. Okay, so you're gonna open your eyes. You're gonna do your corneal. Okay, just gonna touch your corneal. Okay. Okay, so other one I'm going to just check here. So you chew something like you chew mastoid. It's good. Can you? Okay, wonderful. And then chew. So that is great. So the other one I'm going to do is the facial. Okay, so the facial you are going to smile. Okay, great, very good. And you're going to, you smiled already, so that's great. Okay, so that was the facial. So now I'm going to do the hearing test. Okay, to see whether you, how well you hear. You can put your glasses on. Thank you. So we're going to close one ear, this one. I'm going to whisper something. How are you? And I'm going to do the same.
How was your day?
Okay, so you did great. So the ninth one is the glossopharyngeal. So that's going to just do with your gag reflex and your swallowing. So I'll let you open your mouth and check your mouth. Okay, great. And swallow. Any problem swallowing? No, okay. And so you can swallow good, your gag reflex, you have no problem with your speech, your voice, and your words are clear. Okay, so the other one that we're going to do is the last one. No, we're going to do the one where you're going to shrug your shoulder. Okay, so we're going to check for your spinal, so shrug. Okay, and just turn your face, very good. This is the accessory muscle. Okay, we checked and it's intact. And put your head up and down. Wonderful. And the last one, which is going to be the 12th one, that's a hypoglycemic one, is the one we're going to do your tongue movement. Sit, move, stick your tongue out. Okay, symmetry is good. Side and side. It's wonderful. Okay, any problem? No? Okay. You want to sit up better? Okay. Let me know if you're tired.
I'm okay.
Okay, so the next one we're going to check is your arms. Okay, so you're going to stick your arms and it's got good symmetry. Okay. And put your head down. Just going to check your shoulders for any redness, any deformities. And your shoulders seem okay. There's no redness, deformity, no swelling. And the other, I'm going to just check your skin. And the skin turgor is good. Okay, the color is good. You don't have any jaundice, anything, and your fingers are wonderful. Okay, so I'm just going to feel for your joints. Okay, all right. No issues with your joints. No issues with your joints. Okay. So the other one will do your capillary refill. Okay. Great. Let's go to 2 seconds. Alright, so the other one, I will feel for your radial pulse. The radial pulse is fine. Okay, and so your warmness, your arms are nice and warm, so you have good blood flow. Alright, so the next one we're going to do is the range of motion of your fingers. Okay, can you just move your fingers around? It's good. Can you flex your fingers? Flex, okay. Extend. Wonderful. That's great. Can you abduct your finger? Can you adduction? Great, wonderful. And your thumb opposition? That's great. So now we're going to do the wrist. And we're going to do the same with the wrist. So you're going to do the wrist flexion, the extension, ulnar deviation. So the ulnar deviation. The finger goes there. Okay, your ulnar. And now you're going to do the radial. Do the radial deviation. Wonderful. You did great. Okay, how are you feeling?
Okay.
Okay, we'll continue. Okay, so next we're going to do the elbow. Okay, so you're going to flex your elbow and you're going to extend. Any pain? So you have no crepitus also, so that's great. We'll do the same. Flexion, extension. Okay, and the next one we're going to see is your strength for your bicep and your tricep. Okay, so pull, very good. Pull, very good. Okay, and I'm going to do the very good. Wonderful. Okay, so just grab my fingers, not hard, and this one, wonderful. 5/5. You have good grip. Also, so next one we're going to do is we're going to do your shoulders. Okay, for your shoulders, I will just ask you to stand up. Okay, so what we're going to do is you're going to put your hand out like this, facing. Okay, so we're going to do abduction. Okay, bring it down. Okay, so now thumb facing out. You're going to do flexion. Okay, and then you go all the way back like this. Extension. Wonderful. Do you have any pain? Okay, so now you're going to do the internal rotation. Touch your back. Okay. And you do the same with your other hand. Okay, so you did the thing. So now you have to do is the external rotation. So you keep your arms, your elbows close to you, and you stretch out. That's good. Any problems? No problem. So that's good. So that took care of that. So we're gonna now, I'm gonna let you sit down. Okay, so I'm going to do is your hips. Okay, so I'll let you lay down. So we're going to do the hip. No, you stay stiff. Okay, I'm going to do the hip flexion. Let me know. You have any pain?
No.
Okay. Pain? No. Okay. So I'm going to let you come and I'm going to put it so that's internal rotation, external rotation. Okay. And I'm going to do internal rotation. You have any pain?
No.
No. Great. Wonderful. Okay, so let you sit up. All right, so now we will do is some light touch on your extremities. Okay, let me know if you, let me get something sharp. Okay, this, tell me if you feel something sharp.
No. Sharp. Sharp.
No. Okay. Sharp?
Sharp. No.
Okay, so you did great over there. So what I'm going to do is I'm going to just write something on your hand, all right? You tell me what I'm writing.
2,
Okay, this hand.
3,
Wonderful. I'm going to give you something to hold. You tell me what it is. Okay, I'm giving you. Just feel it.
a pen light.
Okay. And I'm going to see if I can find something for you. Okay, using this hand. Tell me what that is.
Phone.
Okay, it sounds, that's great, wonderful. So, all right, so we did that, and now I'm going to check for your deep tendon reflexes, all right? So what I'm going to do is I'm going to just going to hit it gently just to see your reflexes, okay? So I'm going to do the brachioradius reflexes, all right? All right, so that is that. I'm going to do your bicep. Okay. Do the tricep. Okay, so that's good. I'm going to do your patella. Okay. legs seem good. You have no swelling, no edema. Your knees are symmetric and no edema. The color is good if you want to touch. Alright, I'm just going to do the capillary refill of your toes. Good. Okay. Wonderful. So I did the capillary refill is good. Alright, and the color of your thing is good also. So what I want you to do is I'm going to just so everything seems fine with your refill and everything, and I'm just going to check for your tibial pulse. Okay, so dorsal tibial pulse is good. It's good on both of them. Okay, so I'm going to do your posterior tibial pulse. This is good. And this is also good. So I'm just going to see the strength on your, can you do the plantar flexion? Then extension. You do the range of motion. Any pain, any discomfort? Okay, I'm just going to examine your foot. It's okay. And it's great. Nothing there. You don't have any sores or anything. Okay, so let's see now. We're going to just let you stand up because I'm just going to see if you have any scoliosis or anything on your back. Okay, can you bend over? Okay, so no scoliosis. Your spine, you're flexing it really well, so it's great. Now we're just going to check your gait when you're walking. So you walk regularly. How do you walk? Okay, so that is great. So now we're going to do is we're going to do the tandem walk, which you're going to put each foot in front of the toe. Wonderful, great. Okay, so we're going to do a Romberg test where you're going to keep your feet together. Okay, close your eyes. And if you sway, don't worry, I'm right here. Okay. Put your hands in the front. Okay. Close your eyes. You look great. Wonderful. Okay, have a seat. Okay. Do you need help? Are you okay? Okay. Okay, sit down. Alright. So I think that should conclude our assessment. How do you feel?
I feel great.
Well, you did very well, and I want to thank you for coming in for your physical. And I will, everything seems fine. So thank you so much. Thank you for your time.